What does a CORT scan show for hemorrhagic stroke? Imagine trying to find a hidden leak in a pipe. A computed tomography scan, or CORT scan, acts like a high-tech flashlight that helps doctors spot bleeding inside the brain during a hemorrhagic stroke. When someone has a hemorrhagic stroke, blood escapes from damaged blood vessels and pools within the brain tissue. On a CORT scan, this fresh blood appears as bright white areas because it is denser than normal brain tissue. These hyperdense regions are the key signs that doctors look for to confirm bleeding. The scan can reveal exactly where the bleeding is happening. It might show blood within the brain tissue itself, which is called an intracerebral hemorrhage. This appears as a well-defined, bright white spot, and its location can be in different parts of the brain like the lobes, basal ganglia, or thalamus. Knowing the location helps determine the cause, such as high blood pressure or a ruptured aneurysm. Sometimes, blood collects in the space between the brain and its protective membranes, known as a subarachnoid hemorrhage. This also shows up as bright white on the scan and is often linked to aneurysms or head trauma. Blood can also extend into the brain's ventricular system, which are fluid-filled spaces inside the brain. When blood reaches these areas, it can block the normal flow of cerebrospinal fluid, leading to a dangerous condition called hydrocephalus, which causes increased pressure inside the skull. Over time, a hemorrhage can cause swelling or edema around the bleed, which appears as darker areas on the scan. This swelling can put pressure on surrounding brain tissue and worsen the situation. Sometimes, the scan shows signs that the bleeding might be getting worse or is more complex. Patterns like the swirl sign, which shows mixed densities within the hemorrhage, can suggest ongoing bleeding or clot formation. Other signs like the blend sign or island sign indicate multiple small bleeds near the main hemorrhage, which can be linked to poorer outcomes. To get a clearer picture of the blood vessels that may have caused the bleed, doctors often perform a CORT angiography. This special scan uses contrast dye to visualize arteries and veins, helping identify aneurysms or abnormal blood vessels. A CORT scan is the first and most important imaging test used when a hemorrhagic stroke is suspected. It quickly and clearly shows where the bleeding is, how big it is, and if there are any complications like swelling or pressure buildup. While CORT scans are excellent at detecting blood, they may miss very small hemorrhages or early ischemic changes, which sometimes requiring an MRI for more detailed imaging. Overall, the scan provides crucial information that guides urgent treatment decisions and helps predict how the patient might recover. Remember, always consult healthcare professionals for diagnosis and tailored care, as each case can be quite different.